Welcome back. It's Maddie again. We're on the third video clip. This is going to talk about the living will, and it will be presented in two parts because this conversation deserves a little bit more time. So if you go to pages 5, 6, and 7, that's what we're going to cover in the next two parts. So the page 5 is titled Treatment, Preferences, and the Living Will. So this is going to talk about the 3 different conditions and your options for care in those conditions. But I do want to start off by saying, we just talked about your healthcare agent and the everyday decisions that they might be expected to make for you. The living will is a specific opportunity for you to give extra guidance to your healthcare agents and your physicians and your family as to what kind of care you would want in 3 conditions. So these 3 conditions are described here, and we're going to go over them each individually because they deserve some conversation. And then it gives you the opportunity to tell your healthcare agents what kind of care you would want. So in the first part, we're just going to go over the 3 conditions. And the second part, we'll go over the care options. So I don't want you all to be confused. It's just that it's a lot, and it's a very important conversation you should have with your family and your doctor as to what kind of care you would want, what you consider the quality of life that would be acceptable to you if you were ever to be found in one of these conditions. So on the top of page 5, it does have a little space there. It says statement of your goals and values. And this is important. People often will fill this out as to what kind of things are important to them when it comes to their quality of life, especially if they were to be, to be in one of these conditions. So, and that's A. So B talks about a terminal condition. And a terminal condition is really, it might be different than what you think. Most people, when they hear terminal, say, oh, that's a life expectancy of 6 months or less. But for the purpose of this document, and before we would follow your instructions, 2 doctors have to actually certify that you are in this condition. And it means a little bit different than I think what you might think. So I'm going to read it. It says, for your preferences in a terminal condition, which, okay, 2 doctors, if your doctors certify that your death from a terminal condition is imminent, even if life-sustaining procedures are used. So what that means is that imminent usually means hours to days, maybe a week or so, but not 6 months. And basically, it doesn't really matter what kind of life-sustaining procedures they use. You know, that could mean putting you in the ICU, on a ventilator, getting dialysis, getting medications to keep your blood pressure up, intubated on a ventilator. None of that is going to save your life at this point, in the sense that whatever condition you have has progressed to the point that your life expectancy is not long. So this question, sometimes people say, what does this mean? And really it's asking you how you might want to spend your last hours or days of your life. And then we'll talk about what your treatment options are in the next part. But this is a pretty extreme condition, and it is worth a conversation and some reflection as to what kind of care you might want if you were ever to be in that condition. The second condition talks about a persistent vegetative state. Again, I'm going to read that definition out loud. So it says that if my doctors certify that I am in a persistent vegetative state, that is, I'm not conscious, I'm not able to interact with others, I'm not aware of myself or my environment, and there's no reasonable expectation that you would regain consciousness. So, it's pretty self-explanatory, but again, it is an extreme condition, and it is worth a conversation as to what kind of care you would want if you were ever to be in that kind of condition. The third condition, D, talks about your preference in an end-stage condition. And this is probably the most difficult for people to kind of wrap their head around, again, because of all the advances in healthcare and chronic illnesses and people really having a better quality of life with those medical interventions. Even on TV, you hear things about, end-stage COPD or heart failure or kidney disease. So people are being managed medically very well with some of these conditions. But an end-stage condition means something very different for this document to be executed. So I just want you to listen to this and read it and think about what it means to you. That if your doctor certify that you are in an end stage condition, so that is an incurable condition that will continue its course until death and has already resulted in your loss of capacity and complete physical dependency. So what this means is that you have lost the ability to make your decisions permanently, and you are in need of help with every aspect of daily living. So that means you can't feed yourself, dress yourself, go to the bathroom, walk, you know, anything that, you know, any of that independent things are gone. So you are in need of help with every aspect of daily living. So that's what this end stage condition means for this document to be valid. So they are pretty extreme, and they mean different things to different people. And again, this is where that conversation with your family and your doctors really comes into play, because these conditions do affect your quality of life. And it's important for your family and your loved ones to know what kind of care you would want if you were ever in that condition. So those are the 3 conditions. We're going to stop this video clip here. And then the part 2 will talk about your treatment options and the effect of your stated preferences. All right. Thank you.